All right. So in a moment, I'm going to ask you, John, to do 2 movements. I'm going to let you feel what these movements feel like first. You're going to, this is called medial rotation of the tibia. So without moving your upper leg, you're going to medially rotate your tibia like that. Okay? So I'm just going to talk about medial rotation of the tibia. So here is his tibial tuberosity, and in non-faulty posture, the tibial tuberosity would actually be in line with the AIIS. The plumb line would be coming straight down, and then it would be completely in line with the midline of his foot, the space between his second and third metatarsal. John, how does that look from your perspective? Is this straight?
A little more to your right.
To my right?
Right there.
Okay. So here is his tibia, his distal tibiofibular joint and his proximal tibiofibular joint in neutral as it pertains to rotation. In a moment, when I ask him to actively do that movement where he rotates his tibiofibular joint, if he could rotate to the point that the midline of his foot wound up all the way to here, that would be 90 degrees. We're only looking for 20 to 30 degrees. So if this is 90, half of that would be 45. So you just eyeball it, basically. If you can see a right angle, if you could see 90 degrees and then find the midpoint between that, you can see 45 degrees. And if my sticks were more narrow, it would also change things a bit. They're a little bit thick, these dowels. So now if this is 45 degrees, 20 to 30 degrees is going to live somewhere in here. So John, I'm going to ask you on your own to medially rotate your tibia. Good. And now I'm going to find where the midline of his foot is, which is now here. And it looks like he is within range. Okay? And if I did that on him passively, it would be a tissue stretch end feel. Come back to neutral, please. So now, in a moment, I'm going to ask you to do lateral rotation of your tibia. We're looking for 30 to 40 degrees with a tissue stretch end feel when we do that passively. Keep your foot up like this. It might help you with the movement. Please help me. Is this your midline of your foot, John?
Yes.
Okay. So now in a moment when he does this on his own, he's going to laterally rotate his tibia. And we are looking for 30 to 40 degrees. This would be 90. This would be around 45. So anywhere between here and here should be normal. So actually what I'll do is ask you to do that movement now. Excellent. And so here is the midline of his foot at this point. So he is within range. Any discomfort or pain?
No.
Okay. And come back to neutral. Well done. Thank you.